As we get older, life slows down, but some habits quietly speed up our decline. Not because we're careless, but because no one ever told us they were dangerous. We shrug them off, thinking, it's just a part of aging, while silently, they chip away at our health, memory, energy, and even dignity. But what if a few simple changes could add not just years to your life, but life to your years? Today, we're uncovering 12 sneaky habits most people ignore in old age. They seem small, but the cost, tremendous. Let's break the silence on what really steals your strength. If you're over 50 and care about staying independent, strong, and happy, hit that subscribe button. You deserve the truth about aging well. Like, comment, and share with someone you love. Because every senior deserves to know what's quietly harming their health before it's too late. Skipping strength exercises. Skipping strength exercises after the age of 60 accelerates a process the body is already going through: muscle loss, also known as sarcopenia. This isn't just about feeling weaker or being unable to lift heavy objects. It directly affects balance, stability, and coordination. Without regular strength-building movements, the body begins to lose not just muscle mass, but also function. According to the National Institutes of Health, older adults can lose up to 3 to 5% of muscle mass per decade after the age of 30, and the pace increases significantly after 60. What often starts as mild weakness can eventually lead to serious mobility problems. Some doctors warn that lack of strength training is one of the most overlooked causes of senior falls, which are the leading reason for injury-related deaths in older adults. Without muscle support, bones are left more vulnerable. A simple stumble can result in a hip fracture, a broken wrist, or worse, loss of independence. Hospitals frequently see seniors who were fully active just weeks before, suddenly confined to a bed or walker, all because their bodies were not prepared to catch them in a moment of imbalance. And recovery, especially without prior muscle conditioning, can be slow and incomplete. Strength training doesn't mean lifting heavy weights at a gym. It includes simple resistance movements like chair stands, wall push-ups, or light dumbbell lifts that can be done at home. Physical therapists often recommend strength routines to prevent frailty syndrome, a condition where the body becomes severely weak, tired, and less resilient to illness. Maintaining strength also supports better posture, protects joints, and even improves metabolism and blood sugar control. Avoiding strength exercises isn't just a missed opportunity, it's a health risk. It silently erodes the very foundation of independence. A strong body in older age isn't a luxury, it's protection, it's dignity, and most importantly, it's possible at any age. Doctors often remind patients that muscle can be built even in their 70s, 80s, or 90s. The danger lies not in starting late, but in never starting at all. Eating too little protein. Eating too little protein in older age leads to muscle breakdown, slower healing, and a weaker immune system. While many people assume protein needs go down with age, research shows the opposite. Older adults actually require more protein per pound of body weight than younger adults to maintain muscle and support vital functions. According to recommendations from the European Society for Clinical Nutrition and Metabolism, older individuals should aim for at least 1.0 to 1.2 grams of protein per kilogram of body weight daily, higher than the standard adult recommendation. This helps offset the natural muscle loss that begins around age 50 and accelerates with time. Muscle is critical not only for strength and mobility, but also for recovery from illness or surgery. When protein intake is low, the body draws amino acids from muscle tissue, leading to further weakness. Some studies have linked insufficient protein in seniors to an increased risk of frailty, falls, and even hospitalization. Healing also slows down, as protein plays a vital role in rebuilding tissue, forming antibodies, and fighting infections. Even minor injuries can take longer to recover without adequate protein in the diet. Older adults sometimes reduce their protein unintentionally. Appetite changes, dental problems, difficulty cooking, or outdated dietary beliefs may lead to meals that are too low in quality protein. Skipping it regularly can result in gradual but serious health consequences. Some doctors emphasize that protein isn't just about meat. It can come from eggs, dairy, fish, or plant-based sources, depending on individual health needs. Regardless of the source, the priority is consistency and sufficient intake. Avoiding protein might seem harmless at first, but the effects build silently. It weakens the very systems that aging bodies rely on to stay strong, resist illness, and recover from setbacks. Eating enough protein is not just a nutritional choice. It's a daily investment in mobility, independence, and resilience. Not drinking enough water. Not drinking enough water in older age can quietly trigger problems that many don't immediately recognize as dehydration. Unlike younger people, seniors often don't feel thirsty until their body is already lacking. Fluids. This makes mild dehydration especially common and dangerous. Even a small drop in hydration can lead to fatigue, headaches, dizziness, or confusion. Some doctors warn that these symptoms are often mistaken for signs of aging or early dementia, when in fact, the brain is simply not getting enough water to function properly. The kidneys also become less efficient with age, making it harder for the body to conserve water. As a result, older adults may need to drink more, not less, to maintain the same fluid balance. When hydration is too low, the urinary tract becomes more vulnerable to infection. Studies have shown a direct link between dehydration and increased risk of urinary tract infections, which can cause discomfort, fever, and even hospital visits in older adults. In more serious cases, these infections can spread or cause delirium, especially in those already managing other health conditions. Dehydration can also affect blood pressure, digestion, and heart function. Thickened blood, due to low fluid volume, puts extra strain on the heart and increases the risk of clots. Some medical guidelines recommend that older adults aim to drink even when they're not thirsty, as thirst alone isn't a reliable guide past the age of 60. Avoiding dehydration means being proactive. It doesn't require large amounts of water all at once, but small, steady intake throughout the day. When fluid levels are stable, energy improves, thinking becomes clearer, and the risk of infection drops. Failing to drink enough may not seem serious in the moment, but over time, it silently weakens nearly every system in the body that's working hard to keep you independent and well. Oversleeping or staying in bed. Too long. Oversleeping or spending too much time in bed, especially more than 9 to 10 hours a day, can quietly contribute to a range of physical and mental health problems in older adults. While rest is essential, too much of it may actually signal that something deeper is going on, such as undiagnosed depression or chronic fatigue. Some doctors caution that excessive time in bed can reduce blood flow, worsen joint stiffness, and weaken the body's natural rhythms. Instead of feeling more refreshed, the result is often increased grogginess, discomfort, and a decline in both energy and mobility. Circulation becomes less efficient when the body stays still for long periods. When lying in bed for hours without movement, blood tends to pool in the lower extremities, which can increase the risk of blood clots or swelling in the legs. In people already dealing with reduced mobility or cardiovascular conditions, this can pose a serious danger. Prolonged inactivity also affects the joints. Older adults who remain in bed too long may notice their arthritis symptoms become more severe. The joints become stiff, painful, and harder to move, especially in the morning. Oversleeping may also interfere with sleep quality at night. It disrupts the body's internal clock, leading to irregular sleep cycles that make true rest harder to achieve. This cycle can then feed into feelings of sadness, anxiety, or isolation, common signs of depression in older adults. Some research has shown that regularly sleeping more than 9 hours a night is linked to higher rates of cognitive decline, slower reaction time, and even increased risk of chronic disease. Avoiding excessive time in bed supports both the body and mind. Rest should be balanced with light movement, routine, and mental engagement. Staying in bed too long might feel comforting, but over time it silently encourages physical decline and emotional withdrawal, both of which chip away at the freedom and strength that aging adults work so hard to maintain. Isolating yourself socially. Isolating yourself socially in older age can be far more harmful than most people realize. Research shows that chronic loneliness carries a greater health risk than obesity, and some studies even compare its impact to smoking 15 cigarettes a day. Social disconnection doesn't just affect mood, it affects the brain, heart, and immune system in powerful and damaging ways. When regular interaction fades, the brain is deprived of the stimulation it needs to stay sharp. Over time, this increases the risk of cognitive decline, memory loss, and dementia. Some doctors warn that emotional isolation is linked to a significantly higher chance of developing heart disease, high blood pressure, and stroke. This is partly due to the stress hormone cortisol, which can rise when a person feels persistently lonely. Elevated cortisol damages blood vessels, weakens the immune response, and interferes with sleep. For older adults who may already be managing chronic conditions, these effects compound and can lead to more serious complications. The emotional toll of isolation is equally dangerous. Seniors who remain socially withdrawn are at a much higher risk of depression and anxiety. Without meaningful interaction, a person may start to lose their sense of purpose or feel forgotten, which can quietly lead to withdrawal from self-care, appointments, or even medication routines. This emotional decline doesn't always show up as sadness. Sometimes it shows up as fatigue, irritability, or a loss of interest in once-loved activities, symptoms that are often mistaken as just aging. Staying socially connected is not about being busy or popular. It's about meaningful interaction. Whether it's a phone call, a shared meal, or a regular group activity, these small moments keep the mind engaged and the heart supported. Avoiding. Isolation protects not just mental health, but physical strength and overall resilience. When connections fade, so does the spark that helps many older adults continue to thrive. Neglecting oral hygiene. Neglecting oral hygiene in older age can lead to more than just bad breath or tooth loss. It can quietly set off a chain reaction that affects the entire body. Gum disease, which becomes more common with age, has been strongly linked in studies to heart disease, stroke, diabetes complications, and even Alzheimer's. When the gums become inflamed and infected, harmful bacteria can enter the bloodstream, triggering inflammation throughout the body. This inflammation is known to damage blood vessels and increase the risk of cardiovascular events. Some doctors warn that poor oral health can interfere with blood sugar control in diabetics, making it harder to manage the condition. For seniors already living with diabetes, unchecked gum disease may worsen symptoms and increase complications. In addition, research has shown a troubling connection between chronic gum inflammation and cognitive decline. Scientists believe the bacteria associated with gum disease may travel to the brain, contributing to memory loss and raising the risk of Alzheimer's. Despite these dangers, regular dental visits often decline with age. Seniors may avoid care due to cost, mobility issues, or the mistaken belief that losing teeth is simply part of aging. But skipping checkups allows small problems, like plaque buildup or bleeding gums, to grow into serious health threats. Even simple daily habits like brushing and flossing are sometimes missed, especially for those dealing with arthritis or limited hand strength. Maintaining oral hygiene is not just about preserving a smile. It's about protecting the brain, heart, and immune system from hidden threats that begin in the mouth. Avoiding dental neglect in later years isn't cosmetic, it's essential. Regular care, both at home and from professionals, helps safeguard overall health and keeps dangerous inflammation in check. Using multiple medications. Without review. Using multiple medications without regular review is one of the most overlooked dangers facing older adults today. This issue, known as polypharmacy, happens when someone takes several prescriptions, over-the-counter drugs, or supplements at the same time, often prescribed by different doctors who may not be aware of each other's treatments. As the number of medications rises, so does the risk of harmful drug interactions, side effects, and even life-threatening complications. Some doctors warn that polypharmacy is a silent killer among seniors because the symptoms it causes, such as dizziness, confusion, fatigue, or memory loss, are often mistaken for normal aging. In reality, these symptoms may be signs of medications clashing in the body, interfering with brain function, or affecting liver and kidney performance. A study in the Journal of the American Geriatric Society found that adverse drug reactions
send tens of thousands of older adults to the emergency room every year, many of them due to drug combinations that were never properly reviewed. The danger increases when medications are continued out of habit, even if they're no longer needed.
Seniors might stay on pills for decades without knowing that a newer treatment could be safer, or that a past condition has resolved. In some cases, the original dose may become inappropriate as the body's metabolism changes with age. When doctors don't regularly reevaluate each medication, patients remain exposed to risks that could be reduced or eliminated entirely. Avoiding unnecessary harm from polypharmacy means asking for a full medication review, especially after any hospital visit, diagnosis change, or shift in how one feels. Pharmacists and primary care doctors can work together to adjust or stop certain medications when needed. A simple conversation about prescriptions could prevent a fall, preserve memory, or even save a life. Avoiding technology out of fear. Avoiding technology out of fear can be one of the most limiting habits for seniors, particularly as the world becomes more connected through smartphones, apps, and online services. Many seniors feel intimidated by new technology, fearing it will be too complicated or that they'll make mistakes. This reluctance, however, can lead to isolation, missed opportunities, and a lack of access to critical tools that support health and well-being. Doctors warn that avoiding technology in today's age can unintentionally create barriers to essential services and safety features. For instance, medical alert systems, which can save lives in emergencies, often rely on smartphones or simple apps. Seniors who shy away from these tools may find themselves unable to quickly reach help during a fall or health crisis. Additionally, technology enables access to telemedicine, which has become increasingly important for those with mobility challenges or those living in rural areas. Research has shown that seniors who engage with technology, whether through video, calls with family, using a fitness app, or managing health records online, report better mental health and feel more connected to the outside world. On the other hand, avoiding these advancements can deepen feelings of loneliness and disengagement, making it harder to maintain a sense of community and support. While it's true that some technology can be overwhelming at first, many platforms are designed to be user-friendly, with tutorials and simplified interfaces that cater specifically to older adults. Embracing technology doesn't mean becoming an expert overnight, but learning to use just a few key tools can greatly enhance safety, communication, and access to important health resources. Taking small steps to explore new technology can make a big difference in staying connected and protected as we age. Ignoring digestive problems. Ignoring digestive problems as we age can have serious long-term consequences. While constipation, indigestion, and other gut issues are common, they are not a natural or unavoidable part of aging. These symptoms often signal underlying health problems that need attention. Some doctors warn that ignoring digestive discomfort can lead to chronic conditions, including diverticulosis, irritable bowel syndrome, and even more serious issues like colon cancer. When the digestive system struggles, it often reflects overall health, and unresolved problems can affect the immune system, metabolism, and quality of life. For example, ongoing constipation can lead to painful bloating, hemorrhoids, and increased strain on the heart, especially for those with pre-existing heart conditions. Indigestion, if not addressed, can also increase the risk of acid reflux, which can damage the esophagus and lead to ulcers over time. Gut health is deeply connected to overall well-being, including mood regulation and energy levels. A disruption in digestion can contribute to fatigue, irritability, and even feelings of depression. Many seniors mistakenly believe these issues are just a normal part of growing older, but doctors emphasize that they should not be ignored. Simple. Lifestyle changes, such as improving diet, staying hydrated, and increasing physical activity, can greatly improve digestion. However, it's important to consult with a healthcare provider if these symptoms persist or worsen, as they may be indicators of more significant conditions. Taking early action is key to preserving long-term health and preventing more complex problems down the road. Not getting enough sunlight or vitamin D. Not getting enough sunlight or vitamin D can have a profound impact on health, especially as we age. Vitamin D is crucial for maintaining strong bones and muscles, as it helps the body absorb calcium. Without sufficient vitamin D, bones can become brittle, leading to an increased risk of fractures, particularly in seniors. Some studies suggest that a deficiency in vitamin D also contributes to muscle weakness, which can lead to falls and a decrease in mobility. In addition to bone and muscle health, vitamin D plays a key role in mood regulation. Research has shown that low levels of vitamin D are linked to depression and other mood disorders. This is particularly concerning for older adults, as depression can impact quality of life and overall well-being. Unfortunately, many seniors tend to avoid sunlight due to skin concerns or may not get outside enough to absorb the necessary amount of vitamin D. Others may forget to take supplements, despite their importance in preventing deficiency. Doctors, emphasize the importance of sunlight exposure in moderation, as it stimulates the production of vitamin D in the skin. However, during the colder months or for those who spend most of their time indoors, supplements may be necessary to maintain healthy levels. Regular blood tests can help determine if vitamin D levels are adequate. Ensuring proper intake through either sun exposure or supplements can significantly improve overall health, boosting both physical strength and emotional well-being. Being too polite with doctors. Being too polite with doctors can have serious consequences, especially for seniors. Many older adults, out of respect or concern for their healthcare provider's time, may downplay symptoms or avoid bringing up issues that seem minor. However, this can lead to missed opportunities for proper diagnosis or treatment. Some studies show that seniors are less likely to report discomfort, fatigue, or changes in their health, which can delay important diagnoses. For example, ignoring subtle signs of heart disease, cancer, or diabetes can result in conditions worsening before they are properly addressed. Doctors stress the importance of being open and direct about all symptoms, no matter how small they may seem. Asking questions and discussing concerns fully can ensure that a health issue is not overlooked. Senior patients should feel comfortable sharing all aspects of their health, including new or unusual symptoms, without fear of burdening their doctor. In some cases, skipping this vital information can lead to misdiagnosis or a delayed treatment plan, especially in conditions where early intervention is key to improving outcomes. The best approach is to be proactive in health conversations. This means not only asking questions, but also seeking clarification when something is unclear. Research shows that patients who engage actively with their doctors tend to have better health outcomes because their conditions are addressed promptly and accurately. A candid, open line of communication can make all the difference in achieving the best possible care. Holding on to bitterness or regrets. Holding on to bitterness or regrets can take a significant toll on physical health, especially as we age. Emotional pain, when left unresolved, creates a constant state of stress that can have harmful effects on the body. Some doctors warn that harboring resentment raises levels of stress hormones like cortisol, which can negatively affect heart health and the immune system. Chronic stress has been linked to higher blood pressure, which over time increases the risk for heart disease and stroke. Additionally, stress weakens the immune system, making the body more vulnerable to infections and illnesses. Research shows that unresolved emotional pain can also lead to muscle tension, headaches, and digestive issues. The constant activation of the body's fight or flight response creates a cycle that keeps the body in a heightened state of alert, which accelerates aging and contributes to various chronic conditions. Some studies suggest that people who hold on to negative emotions, such as resentment or regret, tend to experience a faster decline in cognitive function, increasing the risk for conditions like dementia and Alzheimer's. Learning to let go of bitterness and regrets is crucial for emotional and physical well-being. Forgiveness, whether toward others or oneself, has been shown to reduce stress, lower blood pressure, and improve overall health. Letting go of past hurts allows the body to relax, reducing the strain on the heart, muscles, and immune system. By freeing oneself from emotional baggage, seniors can experience better mental clarity, improved mood, and a greater sense of well-being, leading to a more fulfilling and healthier life. Taking care of both your body and mind is key to aging well. By avoiding habits like holding on to bitterness, neglecting your health, or ignoring warning signs, you can improve your quality of life and enjoy your years ahead. Prioritize your well-being, stay informed, and take action to live stronger and happier. Remember, small changes can make a big difference in maintaining independence and overall health. Don't forget to subscribe for more tips on aging well, and share this with someone you care about. You deserve to live your best life at any age.